Diabetes: Lifestyle and Treatment Challenges in Women by Deb Ellsworth from Elizabethtown College. Diabetes is a chronic disease condition in which an individual's pancreas fails to produce enough insulin to help metabolize glucose in their bloodstream. Approximately 29.1 million Americans are affected by this disease, and it's the seventh leading cause of death. There are two primary types of diabetes. The first is type 1 diabetes, and this occurs when an individual's immune system attacks the beta cells in their pancreas, causing the pancreas's ability to produce insulin to be stunted. Approximately 5% total of diabetics are affected by type 1 diabetes, and it is normally diagnosed by age 15. This disease has no cure, and those who suffer from it will be insulin dependent for the rest of their lives. Type 2 diabetes occurs when the pancreas fails to produce enough insulin, or the insulin that is produced is not appropriately absorbed by the cells in the body. That's known as insulin resistance, and that affects 95% of diabetics. Type 2 diabetics can control their symptoms and condition through lifestyle and dietary changes, and generally also by the use of oral medications. Some do have to use insulin injection if their condition gets too bad, but unlike type 1 diabetics, they do have some control over the level of their disease and can go without having to use insulin if they put the proper lifestyle interventions into place. Diabetes can affect women differently than men. One example of this is gestational diabetes, which is exclusive to women because it occurs only during pregnancy. Gestational diabetes is marked by an increase in blood glucose while a woman is pregnant, and the majority of women see this type of diabetes resolve with the end of their pregnancy. However, 5 to 10% of women continue with elevated blood sugar levels and will eventually be diagnosed as type 2 diabetic. Women are also influenced by their hormones in the onset of diabetes, as more women tend to be diagnosed after menopause because it is believed that reduction in the level of estrogen in their bloodstream takes away some of their natural protections against elevated cholesterol. Women in general tend to have a longer life expectancy than men because of the fact that they have a lower risk of cardiac disease. However, women with diabetes have a 6 times higher chance of developing cardiovascular related comorbidities than women who do not once diagnosed, and a lot of this comes from elevated cholesterol levels. Comorbidities for women with diabetes can include cardiovascular disease, which comes at a more elevated rate, as well as chronic kidney disease and neuropathy of the hands and feet. I had the opportunity to interview my friend, who we will call Jeanette, about her experiences with diabetes. Jeanette's family has a strong history of diabetes. Her mother and grandfather were both diabetic, as well as her 2 sisters. Her first experience with diabetes occurred at the age of 25 when she was pregnant with her 4th child. The diabetes resolved after pregnancy. However, when she was 31, she was officially diagnosed with type 2 diabetes and began having to take insulin shots at the age of 36. She currently takes 5 shots of insulin a day, as well as one weekly shot of a different type of stronger insulin that lasts the week through, and she has to check her blood sugar 3 times daily. She has multiple comorbidities as a result of her diabetes, which include ischemic heart disease, chronic kidney infection, chronic yeast infection, as well as neuropathy in both of her feet. It does interfere with her daily activities of living, and she says one of the most difficult challenges is the fact that you have to eat to live, and she's always surrounded by good food because she has a large family, and not being able to partake of food-related festivities as much as those around her can be a little bit depressing and difficult. She also has at least 1 to 2 days a week where she just feels completely drained and wiped out and like not participating in her regular activities of daily living. And when she becomes ill with anything cold or some small infection, she also has to deal with her glucose levels rising to higher than normal type levels, which requires adjustments to her medication. Additionally, she has frequent doctor visits to monitor her condition and also meets with a cardiologist once every 2 months. I also had the opportunity to interview Jamie Henson, certified registered nurse practitioner, regarding how she goes about the screening and treatment of diabetic women. One thing that Jamie mentioned is she looks for different symptoms in women who present for screening in comparison to men. She finds women may present with more frequent urinary tract infections and chronic yeast infections, and that tips her off to screen those patients for diabetes. Once a person is diagnosed with diabetes, women in particular, she tends to follow their cardiovascular blood markers more closely and make sure that they obtain the proper blood screenings to evaluate their cholesterol levels, their ongoing blood sugar levels, and their blood pressure, because women are at higher risk for secondary cardiovascular disease. Some of the challenges she finds in treating individuals with diabetes is that the cost of medication can present a challenge even when an individual has insurance, because some insurance companies limit what types of medicine a diabetic can be on. And even though a patient may respond better to a certain medicine, if their insurance won't cover it, generally it winds up that they can't afford it, and this can lead them to non-compliance. And even when a patient is directed to the pharmaceutical company, who sometimes will give discounts or coupons toward the medication, once the period of them receiving the discounts ends, they find themselves back at square one because, again, the patient can no longer afford the medication. As a review, diabetes is a condition that affects 29.1 million Americans. Type 1 diabetes can only be controlled through use of insulin, where type 2 diabetes can have its risk factors reduced through diet, exercise, and regular screening. Women are at a much higher risk of developing cardiovascular disease if they suffer from diabetes at a rate of 6 times more than a woman without diabetes. I hope you've enjoyed this presentation on diabetes and have learned something new that you haven't known, and are encouraged to get your own self checked and make appropriate lifestyle interventions to reduce your personal risks of being affected by diabetes. Thank you.